So we are lucky to be joined today by Benjamin Yu. Dr. Benjamin Yu is a physical therapist. Prior to getting into physical therapy, he got an undergraduate degree in economics at UC Davis. He graduated from that in 2011, after which he spent some time in the business sector and then transitioned to the physical therapy field, where he graduated in my class of DPT students in 2019 at the University of Southern California. So Ben, welcome. Thanks for joining us.
Thanks for having me, man. Stoked to be here.
So can you give us a little bit of background about how you got into physical therapy? Because obviously this wasn't your first professional career.
Totally. Yeah, man. I graduated with an econ degree, worked in business for like just a year or two and found it very unfulfilling. And then quit my job after about a year. I was interviewing for some other positions, in finance or management or this and that. And all of it was just kind of just going through the motions. None of it was very appealing to me. And, growing up, I always thought you just collect a paycheck and you go and live your life and you should be fine. But soon realized that if you're spending, 40 to 60 hours a week at a job that you don't enjoy, it's like the number of hours you're spending there are, far outweigh the number of hours you would be spending with loved ones or doing things that actually add value to your life. So honestly, what a waste of life if what you do on a day-to-day doesn't add value, right? So that I already knew I was, unsatisfied with my career, but I ended up taking some time off because I had some stuff that happened with my family, and both my parents had fallen ill. So I took some time off to care for them for about a year until things kind of settled down. And then when things settled down, I had found physical therapy. It was recommended to me, something like that might have matched my lifestyle a little bit better. So I started to check that. I checked it out a little bit more. I looked into it a little bit more, and I found it to be really interesting. Because initially I didn't understand what physical therapy was. I thought it was more like personal training or this or that. And I have a background in that, and I didn't really see myself doing that as a career. But as I got more and more into physical therapy, I had to go back to community college for 2 years to get all my science prereqs because I didn't have any of that with an econ degree. And as I was studying all this stuff, I found it fascinating. And then once I got into PT school, I knew I was in the right place. So that's eventually how I got there.
Now, the typical path, if we're going to talk about typical paths, the typical path for a physical therapist is to go and work for a clinic. So you are a physical therapy, clinician on staff, and you're treating patients underneath your clinic director or owner, whatever. Why was this not the model for you? Because clearly you've already started your own clinic. And I know, because I know you, that you started your own clinic immediately out of finishing an orthopedic residency. And I would argue that that's relatively rare. Not many clinicians will go straight into clinical practice ownership.
So why was it not for me? I think a handful of things. I think, I guess where to start. I guess number one was, I never liked, when I started getting into it and I was volunteering places and working at places and that kind of thing, working in these in-network models, in-network being like in-network insurance. We know that, insurance reimbursement rates have gotten lower and lower over the years. And so in order for these businesses to stay afloat, they have to see 2 or 3 patients an hour, sometimes 4 patients an hour, which I think is completely ridiculous because, quality of care, just continues to suffer. And so in order for these businesses to stay afloat, they have to keep bringing in all these people, but everybody that they're seeing ends up not getting much better. They pay the copay twice a week for like 6 months and they get marginally better because there's just not enough time or attention being given to them, the kind that they need in order to get well. And so, kind of seeing this and also seeing all the politics and the bureaucracy and all this stuff, you have all these things you have to do just for the sake of doing them. I found it completely pointless and kind of frustrating because, you become, or at least for me, it's like I became a physical therapist to practice a certain way. Everybody has their own style and their own reasoning and all these kind of things. And that's kind of fostered in physical therapy school, at least, right? Fostered to a certain extent. But then if you end up in a clinic that let's say an in-network provider, right? Um, you know, a lot of how you practice is dictated by insurance companies or your boss or whatever else. You know what I mean? And I found that already to be kind of stifling. So I never wanted to put myself in that position. And I wanted to be able to provide a high level quality of care for my patients. And I think in order to do that, I needed to kind of operate on a network. Um, yeah, yeah. I think
So
secondary. Sorry, real quick too. I think secondarily it was also I found this career again later, a little bit later on in life. So I'm a little bit older than some of my classmates and that kind of thing. And so me also knowing that I didn't want to just get stuck in a dead end job where there's a salary cap or whatever there is. It's like I was already planning to have a family. I wanted to be able to provide for that family, and I wanted to have autonomy of practice and just freedom. You know, I wanted to use my skill set to help my community, but at the same time have some level of freedom. And I think working for somebody else doesn't always provide that. You know, so all those things considered, I decided to keep my head down and work as hard as I could in the short amount of years that I was in school or residency, so I can learn as much as I could, so that by the time I finished all that, I could be confident going out and doing my own thing, which is where I'm at now.
yeah, so you own Longevity Performance Institute. Now, can you tell us about the philosophy of your treatments with your patients there, and why this clinic is different?
Yeah. So again, like I mentioned, I think time is huge. So all sessions here at LPI Physical Therapy, they're 60 minutes one-on-one with the doctor of physical therapy, which is me. No assistants, no aides, and no useless modalities. I know a lot of these in-network providers. It's like they put them on ice and heat and ultrasound and electrical stimulation. They do all those things not because the research is clear. You know, a lot of that stuff is useless, but they do that because insurance still bills for the use of those modalities, and so it's a waste of everybody's time and all this stuff. But anyway, this model is different. It's patient centered rather than profit centered, and it's also a hybrid model, meaning there are a handful of folks that I see in person. And then once they get to the middle or late stage rehab, either I continue with them in person or they graduate to a membership model where they're managed digitally. So as they're getting more towards sport performance or just towards their graduation, being done with physical therapy, at the end of the day, what they really need is consistency, allowing enough time for their tissues to adapt to certain stress that they're putting on. So consistently exercising, and they need accountability. So the thing that's different here is it's a very personalized service. All my patients have 24-hour access to me through text message. I follow up with them. If they're not adhering to the program, I keep them accountable, and that's actually why they get better. It's not only because the diagnostics and the cueing and all this clinical reasoning is good. At the end of the day, it's keeping people accountable for putting the right kind of stress on their body to adapt themselves out of the painful cycle that their bodies have adapted into. Yeah.
Now, one thing that you taught me about through a conversation that we had was the abundance mindset. Can you speak a little bit about that, and then how that infiltrates into your practice?
Yeah. Yeah. So the abundance mindset is something that a few mentors of mine harp on a lot. And so it's just this idea that always give as much as you can and to every capacity. And I think, I've only been in business less than a year, and I've been very lucky to have a very full patient caseload, after the first couple of months. And I think it's because these mentors have taught me this early on. And even before I had this practice, I was trying to give away as much as I could, as often as I could, meaning, I gained these skill sets as a student in order to help my community and help these people who end up in pain. And as early and as often as I could, I just give this away. It's like, hey, can I help you out? Can I practice these things? And it's a very mutually beneficial relationship, because I get to practice getting better and treating people, and then the people who I treat get to reap the benefits of that as well. And so I think extrapolating that into this business model, I'm very much that way. Again, patient centered more than profit centered. If patients need me to keep them accountable more, some people, they ask me to text them every day. I text them every day. Some people need me to keep them accountable once a month. I do that, right? And if they need rehab equipment, I send it to them free of charge. They've already paid me for my services, but I want to make sure that they feel they're getting well taken care of through all aspects, right? Logistically, practically, and also physically here, mentally. We address everything. So I think I think too many people operate from this idea of a scarcity mindset, which is the antithesis of abundance, and it's like I don't have enough. I need to hold on to every penny that I gain. I need to try to be very strict with my time and all this stuff. And for me, I've never been that way, and some of my mentors have just cultivated that further for me. And I've found it to pay back tenfold, because if I have an extra 20, 30 minutes and my patient needs that, I'll give it to them, no problem. You know what I mean? And I think that has, I've never gone into it, at least with the mindset of I'm going to do this so I get more back. I think it's just I've conditioned myself to always want to kind of be this way, and all the good that has come from it, I kind of attribute to that.
So can you tell us a little bit about the caseload that you guys see at LPI? So can you talk us through the typical patients that you are working with?
Yeah. So the niche that we serve the most, or the niche that we market to the most, they're typically weekend warriors, adult weekend warriors. So folks between, let's say 30 to 55. They have some sort of athletic background, or they like being active, and they had a chronic injury. So they've had a number of injuries that have kind of been nagging at them over a period of time. And more importantly, they've already seen multiple practitioners. They've been to a chiropractor, they've been to their orthopedist, they've been to their primary care. They might have even seen a handful of other physical therapists, and they're still in the same amount of pain that they were, let's say a year or two ago. And so those are the people that I like to serve the most, just because for me, it's very intellectually stimulating. They come in and these people haven't been able to solve their puzzle, or solve their problem. And for me, being able to be meticulous about my process and working with them and building this therapeutic relationship, we're able to, find a solution for them. And that's very rewarding for me. But yeah, we tend to want to work with folks like that. But we're also stationed currently inside of a CrossFit gym. So about a quarter of my clients currently are folks right out of the CrossFit gym. So generally people who are active, who like to move their bodies around. But I also get a handful of folks who aren't really that active, but they do fit the category. They've seen multiple people. They've had a chronic injury. They've been in pain for a long time. And so, we get the opportunity to work with folks like that as well.
So where does this typical weekend warrior type of patient, where do they line up with neck pain? So I know that you've seen patients with neck pain, and is this something that's common for this type of patient?
Yes. Yes. I think neck pain and back pain are extremely prevalent nowadays, in our sitting culture and all the above. And, a lot of folks end up getting neck pain or shoulder issues, or, the shoulder girls closely related to the neck and all this stuff, particularly with overhead lifting and, all sorts of things, particularly this past year as well, with the pandemic, everybody working from home, sitting on their laptops all day. I got a lot of neck pain patients, or patients with neck pain rather, over the last year.
Now, can you speak a little bit about your first thoughts when you saw the NecksLevel device? Because, as a physical therapist, we have a library of exercises, and of course, then we have a library of neck exercises. Can you speak a little bit about your initial thoughts when you saw the device and how that could be used in your treatment?
Yeah, initial thoughts were, I think it was genius engineering. I think it was it's sleek design, simple, minimalist, easy to use, easy to transport, and so that was initial thoughts. Just seeing it, and then once you kind of briefed me on the function of it, I was like, dude, this is awesome. This is awesome, because I think normal physical therapy exercises that we're taught for the neck there's only really a handful, and a lot of them are, depending on the person and depending on their body type, sometimes it's really difficult to get the right muscle coordination patterns or train the right things with particular people. But the NecksLevel, I think, kind of streamlined all that, in addition to adding a handful of additional exercises that I think are more functional, being able to train the neck into, different ranges of motion, side bending, rotation, and not only just your simple chin tucks or retractions or whatever it might be, and being able to be very segmental about it as well. I think just having the platform as some sort of external feedback, and to cue things that way, I think has really, I think it's been very innovative, and yeah, it's made neck rehab, I think, sexier and at least easier for clinicians as well to target more specifically, and to work a little bit more meticulously rather than here, do these chin tucks, and it's kind of just global motion, but it's not always as specific as the patient may need, and that's why some folks don't get all the way better.
Now, can you think back to a specific patient case where the NecksLevel device came in handy for you? And can you speak a little bit about why you thought it was helpful there?
Yeah, yeah. So I had a gentleman that I treated, young guy, mid-20s, who had he had a cervical disc replacement because of some spinal cord impingement. And so this was really secondary to some extreme neck weakness that he had developed over a number of years, in conjunction with his lifestyle and some other things that were going on with him. And so when he initially came to me, still a young guy, right? You would think somebody in their early 20s wouldn't have some of these issues. But numbness and tingling through all of his hands, had little to no grip strength, little to no, or still had difficulty walking sometimes, depending on the day and how he would feel in the mornings. Would wake up every morning with paresthesias and neck pain. Every time he would bend over, he'd get shooting pain down his arms. And so, even simple chin tucks were difficult for him. Number one, to coordinate, and number two, to really get just, let's say, deep neck flexors outside of compensatory superficial musculature kicking in. And so the NecksLevel was great for him because, number one, he could train in supine, kind of eliminate gravity. And then number two, just being able to have that feedback and to start improving some proprioception of his neck with the feedback as he's rotating slowly, cueing him a certain way, and then slowly adding resistance. Because for somebody like this, even just the weight of his own head was too much for him, right? So I love that the NecksLevel also has, different bands of resistance you can progress through. And so, we started on the lowest one. He started to build some, general neck strength through normal ranges. And then within a few weeks, all of his paresthesias started to improve, despite his surgeon even telling him that he might have paresthesias for the rest of his life. And so by the time we finished working together, because he eventually moved to China, he no longer had any paresthesias anywhere. He just still had a little bit of neck stiffness, but that was only the course of a couple months using the NecksLevel. And so, excellent results. We did a lot of stuff with the NecksLevel. Whereas if I feel like I was relegated to the traditional, the things that I was taught, and if I only had that, I might have been at a loss. You know what I mean?
Sure. So there's a scenario where, a guy comes in with a really weak neck, and then the NecksLevel strengthening exercises seem to help. Is that kind of the prototypical patient that you'd use the NecksLevel device with? Like, what does the ideal person that walks into your clinic look like if you were saying, I want to use the NecksLevel?
Ideal. I guess there's no real ideal client. I guess what I'm trying to say about that is I feel like I'd use it on almost everybody who has neck pain, because it could be a high level athlete, or it could be somebody like who I just mentioned, and everybody in between could benefit from use of this.
Okay. And then can you speak a little bit about if you have like a standard exercise flow that you'll work your patients through, like maybe on day one in the micro, or, in the macro across a couple of weeks? Like, do you have a flow of exercises or strategies that you use consistently, or is it very patient specific?
It tends to be more patient specific, depending on, I like to run them through everything that the NecksLevel can do first, right? Let me see how well you can rotate. And then let me see rotation against resistance. Let me see some side bending. Let me see the chin tucks. Let me see isometrics and side lying. And let me see the rotations and side lying. We'll go through all that, and then wherever they're deficient is where we tend to focus.
And then I heard you you told me once that you've used your device as a home exercise tool. So you sent a patient home with the device. Can you speak a little bit about that scenario and how you thought it worked out?
Yeah. So I had this other gentleman who's had chronic neck pain following a motor vehicle accident years ago, or was exacerbated by the motor vehicle accident. And he went to his traditional PT route and saw a few folks and never got all the way better, and had kind of been there, had kind of been in that boat for the last year or two. And then when he started working again, he's an occupational therapist. When he started working and spending long hours, he's a tall guy, so he's looking down on his patients often, and for extended periods of time, at the end of the day or even in the middle of the day, he would have pretty bad neck pain. And so day one, we started working the NecksLevel with him together. And his main complaint was, he would get crackling in his neck every time he moved around, but his range of motion and rotation was always stuck at about 45 degrees each way, just from stiffness and from pain. And then within the first, let's say, 2 to 4 weeks, rotation continued to improve. And then now we've been together a couple of months, where after those first couple of weeks, I said, hey, this is great for you. Here's a program to do with the NecksLevel. Take it home and you'll work on this every other day. And he's been pretty consistent with that. And now, a couple months in, now he has full range of motion and it's pain-free and it sticks around. So he still uses it because he's not all the way done, but yeah, it's been great for him.
So for clinicians and specifically PT clinic owners or chiropractor clinic owners, can you speak a little bit about why you think the NecksLevel device is a worthwhile investment for them?
Yeah, again, I think it's innovative. I think it opens the door to allowing you to treat a lot more, a larger patient population, because number one, it just adds a number of different exercises that are available to you. It gives you a number of progressions that you can do. Um, and yeah, I think it's just a great tool overall, for anybody with neck pain, headaches, that kind of thing.
Okay, very good. Now, if you had to be critical of the device, what things would you want to see improved in the coming generations?
Yeah, I think the only thing, as I think we spoke about it briefly before as well, was just the fact that you're on a table, right? So training the neck a little bit more functionally, in different positions, maybe in standing, maybe in sitting. Though maybe you can even prop the NecksLevel against the wall. You can have it suctioned against the wall and do it in sitting or whatever it might be. Just being able to assume more functional positions and train the neck, I think, would be probably the next step, or the next, the evolution of it, perhaps, or maybe just a different device altogether. But yeah, I still think regardless, there's a ton of stuff that can be done on the table, that again can work from low level to very high level athletes.
Okay, very good. Now, is there anything that I haven't really touched on that you like about the device that you think would be worth mentioning for everybody?
No, I think it's great. I think it's great, man. I think you and your team have created something really innovative, something really good for the rehab community. I really do think that every rehab clinic should have one.